Everyone, hello, can you hear me? Thank you for coming. And I'd just like to thank ACE for inviting me to come and share in this session. And I see some of my friends here in the front row, hello, some of my GP friends, and I think it's great that we can all be here. Okay. So this afternoon, basically, I'd like to thank the Primary Care division in MOH for helping me to arrange these slides, and really is to share with you from the family physician's perspective how we as GPs can integrate into the public healthcare system. So, 3 years ago, we had the experience of having to deal with COVID. So I remember when we first started, there was some debate as to whether or not we would activate the pandemic, the public preparedness clinics, and there was some debate about when do we start and when do we activate and so on. But it became very clear very soon that we had to do something because if we did nothing, things would happen. And so we started. And very fortunately, we were given our PPEs and we were able to see our patients and manage them. So shortly after that, there was the proposal to have swabbing in the community, and quite a number of us actually took this up, and it was very successful in being able to diagnose and to manage our cases right there in the front line. And subsequent to that, many of us actually came aboard to administer vaccinations in our clinics as well. So it showed that for the 1,000 over clinics who were PHPC enabled, we could deliver, we could follow protocols, we could do the work that needed to be done. So fast forward to this year when COVID starts to be a bit under control, then you realize that actually we have more than just COVID to manage. And we actually have got populations who actually have health issues. So in the 10 years till now, actually you can see that our life expectancy is one of the best in the world. We're now up to 85 years, average life expectancy. But during that 10 years, you also see that there are a lot of health-related issues. And so things like hyperlipidemia, hypertension, you find that actually a 50% increase in those diagnosed, which is a lot. Diabetes, because I suppose maybe because we've had a war on diabetes, the increase has been less acute. So only about from 7.9% to 8-point-something%. So actually not such a huge increase, but for the others, a huge increase. So you can see that we are actually on the cusp of something not so good. So about 5 years ago, 6 years ago, the primary care networks, all 10 of them were set up to help GPs to manage their chronic diseases in the community. So I'm in one of the PCNs, and basically we receive help to manage our chronic disease patients. So for the vast majority of us, most of our patients are diabetics or they have hypertension or hyperlipidemia, so we are able to manage them in the community. We are able to take their data and we can collate them and send them back to the Ministry of Health. And one of the things that we appreciated was the fact that we got support to do diabetic food screening, diabetic retinal photography, and nurse counseling. All these help to improve the outcomes for our patients. And on the back end, of course, we receive help from our PCN HQs, and they were instrumental in helping us to implement the policies and the protocols. So fast forward again to the beginning of this year, we were told and announced by the Ministry of Health and by our Minister, Mr. Ong Ye Kung, on the advent or the announcement of Healthier SG as a key part of our healthcare system. And this is a huge change because what it means is that for the first time, primary care takes center stage to help to provide this care. And the shift is really to enable GPs and family physicians to anchor preventive care in the community. So Mr. Ong talked about a GP friend who nagged him to do the right thing and keep healthy and so on. So this morning we heard about nudges, So we may be a combination of nagging and nudges, to help our patients achieve their goals. And of course, if you have anything to do with Healthy SG, you realize that there are a lot of components to it. And one of the components is actually to work out care protocols. And these care protocols are supposed to be nationwide, uniform across the island, so that everybody starts from the same page. So I see colleagues from ACE who do a lot of care guidelines here, and basically it's all part of that, so that we all speak from the same page, we tell the patients the same story, we have the same goals, and that's what we want to do. So in order to do that, quite a number of us are actually involved in setting these care protocols going forward. So, you see this timeline, and you can see it starts in July 2021. Actually, it started probably 2015, 2016, when the first PCNs were started. And there were groups of us who were involved in basically a national GP network, actually a council that met on a regular basis to discuss this and to develop what we thought was a vision for primary care going forward. And so you can see from the numbers of involvement that actually quite a number of us organizations were involved. For ourselves, the College of Family Physicians, Singapore Medical Association, AIC, and so on, and the Ministry of Health and the clusters. So it's really a very much a group effort to get to this point. So we hear a lot about Healthier SG, and we have a lot of news. And basically, what's the point of it? Really, it's really to help every Singaporean have their own family physician, someone they can call their own. And the relationship that you have with your family doctor is an important one. I'm happy to announce that today actually is my 30th year as a GP in my practice. So today marks the 30 years when I started in Choa Chu Kang. So, sorry, I didn't mean to get that. But, you see the auntie and the grandmother who used to be a mother, the mother who used to be the kid that you vaccinated, right, 30 years ago, right? And they're bringing their kids to you to vaccinate, and it's a bit special. And I think that relationship is what we all hope will be able to be developed with our patients going forward. So, of course, when you know your patients well, you kepo, right? You want to interfere a little bit, advise them a little bit. Oh, you're smoking. Oh, you're eating this, you're eating that. Oh, you put on weight. Oh, you lost weight. So you notice these over time. So the other day, I had a young lady who came to see me. Her mother said, my daughter has lost weight. I looked at her, I saw her, and the thing is, this is the thing about continuity. You tend to record things. So this young girl was 35 kilos in January. And when I saw her, she was 29 kilos. And she's what, 12? So you can see straight away she was having some issues with her anorexia and so on. So popped her to hospital, and now I'm glad to announce that she's back to 35, 36 kg and monitored closely. So, these are relationships that go on for years and years. So hopefully by encouraging this, making the environment friendly to develop these relationships with government funding and so on, I think we can help to develop health plans for our patients. So that's what you want to do. That's what we aim to do. And of course, without support, you can't do it on air, right? You can't live on air. You can't live on air and water alone. You need some food. So we need support from our community, and we need support from the clusters. We need support from the Ministry of Health. So if you look at Healthier SG, it's nice coin, but what does it mean actually? Basically, The main aim for what we do is our patient. We have no patients, we don't need to be around, we don't need to work. So that's what we do. So we are part of that circle of those virtuous circles that aim to take care of our patients. But you see, the widest circle actually is, you can see, is the environment. So the environment also must be good. I have a coffee shop opposite where I work, and it's been there since day one. It started off as a McDonald's, and now it's a very big coffee shop. So, but everything in that coffee shop represents to me metabolic problems. So although I have a lot of the storeholders, actually I've known them for 30 years. Some of them have been there for 30 years, believe it or not. I have to tell them, the stuff you're cooking, I cannot make it, bro. Right? So I mean, the thing is, it's not just giving pills. It's about getting them to exercise, getting to do stuff and so on. So the environment is important. Get them to stop smoking. So one of the things you get when you're part of a primary care network is that they tend to be a bit anal about stuff, tend to report to you whether you did this or did that. And the best part is when they poke you a bit, they do it anonymously, so people don't know who they're talking about, but it's you because that's your clinic number, right? And then you see, oh my goodness, my vaccination rate is down. Actually, vaccination rate is bad. We get almost free flu vaccines, but our take-up rate is only, 22%? A pneumococcal rate is 14.4%. It's almost free, but, we should all be jumping on the bandwagon and vaccinate everybody because actually it's good for the patient and good for your bottom line. And diabetes, you can see that different take-up rates for different things. Get the patient to your room, give them your urine and blood. It's easy, but get them to come and do a retinal photography or to do a foot screening, it's not so good because they have to make extra trip. So opportunistic stuff is very, very important. Then, of course, you can see even SFL, Screen for Life screening, is variable. Some do it, some don't do it. But what is of concern to me is the breast cancer screening and cervical cancer screening. It's not very good. Could be better. So now that we've heard about Screen for Life, the enrollment will come in phases. I think Ministry of Health understand that we have challenges. We are not all equipped uniformly, and so some of us can maybe take a larger volume, some may not. So it will be implemented in stages. So for those who have chronic illness or more than 60, that's the first phase, and so on. So the other age groups and so on will come later, which is good. I'm glad for that because I don't think I could manage if I did everything in one shot. So basically, what do we do as family physicians, as GPs doing Healthy SG? Well, basically what you would normally do as a doctor anyway. You see your patient, you assess them, you advise them, and then not just with pharmacological treatments, but also exercise. I'm a great believer in lifestyle modification. I have quite a number of patients who have literally reversed their diabetes by strict diet, exercise, weight loss, and so on. So I strongly believe in that. I think less pills is better. Cost them less. It's just that they have to invest more time in it. But the trouble is, when we invest time to tell them these things, right, we don't exactly get paid for the advice. Well, not yet. So we must make sure that what is actually cost-effective should be recognized and taken care of. So one of the things that I found to be very useful is actually the primary care network. I belong to one, and some of my friends here, we belong to the same PCN, and they have been very good to help us to monitor how we manage our patients, and they've actually been supporting us through their teams. So without extra help, I think each individual clinic or GP clinic would have difficulty to manage. So one of the things that we really must do is to get ourselves involved with a primary care network, a support group, who can actually help us to deliver the care. And in doing so, we will be able to manage this mission and actually be able to win the fight. So enrollment is planned for next year, the middle of next year. So I heard that some people wanted it this year, but I thought that would have been good, but really very difficult to achieve. So 18 months is better than 6 months, wouldn't you say? Right. So thankfully, it's next year, so people will get a SMS, and then they will be invited to join. I think it's important that for those of us who are already seeing our chronic patients within the PCNs, that those who are already with us should have the first refusal, right? They should be given a piece of paper saying, you must enroll before this time, because after that, it's open to everybody. Then you have to fight with everybody else. Because they'll have a free choice of their choice. So you imagine you have your oldies don't have that, or they're not sure, they're not enrolled, and then it's open to everybody, and then suddenly you get a whole bunch of folks, your numbers fill up, and then your uncle, auntie, ape, right? They suddenly say, doctor, I want, I said, no more space. Possible, right? Possible, right? Definitely possible. So make sure they get the special offer before the things goes out. So that's what I hope we will be able to do, okay? So to come to the next point, so, how does one join to become a Healthy SG clinic? So I think the most important thing is you must already be doing some of the core schemes. If you've done CHAS, you've done CDMP, MediSafe, you've done Screen for Life, you already know how to do it. So that's a great helper. Ideally, you should have, in fact, not ideally, it's essential that you must have an appropriate IT system. Basically, you need a computer in your clinic. And that computer should, if it's good, do everything automatically for you. So if it's not automatic, then there's no point, right? So you must have it automatic. So the third thing is, find some friends who are in a PCN and join them. Because the PCN will give you the support. Well, they're supposed to give you the support. I'm sure they will give you the support. So please join one. And of course, if you're in a PCN, the PCNs will all be organized to be related to a cluster somewhere. So we have 3 clusters, so that's a given. And of course, last but not least, become a family physician. Okay, and that for actually quite a number of us, we're already on the family physician register. Some of us are qualified but have not applied to be in the family physician register. I think those who have not, I think it'd be good to apply. So if you look at our funding schemes at the moment, okay, for those of us who've done CHAS, okay, that's the bottom one. Then the second part of the pyramid is Screen for Life and the vaccinations. Those 2 schemes have been very useful, very helpful for us to deliver care. Those of us who are on the primary care networks, we actually get Care Plus fees. That means we take care of our patients, we give data, and we are remunerated for the effort. So the very top of this pyramid, the tippy point, actually is the new scheme, and that's to reimburse us for taking care of our patients who are enrolled with us with Healthy SG. I think if you look at this pyramid, it's meant to be like this because the Healthy SG is the last part of this pyramid, the latest one. So this one will actually be in addition to the remaining 3 parts of this pyramid. So there's an additional reimbursement. So we are told that the GPs, the family physicians who are on Healthy SG will receive per capita patient for each resident who's enrolled. And the patients are free to enroll to anyone they wish. But of course, when they enroll, there must be vacancies, because I don't think, I'm not sure whether every clinic can just take everybody who applies to them, because you might have a clinic that maybe have 10,000 people applying and then they will be inundated and so on. So we see how it goes. So watch this space. So for well patients, it's quite straightforward. They come for assessment. They have regular care management, preventive care, and so on. So that's the green one. For those with chronic illness, again, what you would normally regularly do for your patient and so on. So these are the benefits of signing up. We've all gone through this before. And the ministry also are actually going to be looking at certain things like providing chronic drug subsidies, basically providing subsidized drugs, medicines to be available at GP clinics. Okay. So as I mentioned before, it's essential to have a good IT system. You don't want to have to go and have somebody just purely looking at your data and then putting it in. I mean, that is just going to be ridiculous. And I know some GPs actually do it themselves after hours. So you can imagine you do a run, you do a full clinic, and then about 11 o'clock at night, you keep keying all this stuff, and then the gateway dies. And you can't do it, right? You know, it's like the other day, you know, gateway died, right? So it's horrendous. So I'm not a pure IT paperless environment. I run on paper and the computer because I don't trust the computer 100%. Okay, so I think it's important that you have a good IT system. Make sure your IT is robust. Make sure your internet connection is good. I have 3 internet connections in my clinic. It's crazy, but I do, because they've died. Okay. So anyway, so we will be looking, of course, at all these systems, and hopefully we'll be able to decide. I'm sure we will be able to see which ones fit the bill. So, and of course, there will be support for seniors in the proposed elder care centers going forward. So with that, thank you very much.